Now I'd like to talk to you about a couple of side effects. Some of the main side effects that you have with most of the medications are breast tenderness, fatigue, mood swings, bloating, headaches, and changes in libido. On the other hand, I also want to talk a little bit about progesterone. It can cause symptoms that feel exactly like pregnancy. Therefore, it's suggested to get a beta, so a blood test done 14 days after your transfer, so blood pregnancy test to confirm pregnancy. And if not, if you're not pregnant, you should stop the hormones to provoke your menstruation to start again. Sometimes doctors will prescribe medications to your male partner. Most of the medications prescribed are vitamins, like vitamin C, which is recommended approximately 500 milligrams a day, vitamin E, which is 200 IU a day, and beta-carotene, which is 10,000 IU a day, and zinc, which is 10 milligrams a day. What this actually does is improve sperm count, mobility, generally speaking, and sometimes doctors will also want to prescribe an antibiotic called doxylin, which is 100 milligrams 2 times a day from the start of stimulation. So what do I mean as stimulation? It's the time in which they give the HCG shot to the female so that when we do the fertilization with the sperm is infection-free. Now I'd like to talk to you a little about the egg collection and the fertilization. So first, when we look at the retrieval, if you notice here, there is an ultrasound probe. The ultrasound is to look directly into the ovary. There is then a needle that is put through the vagina wall into the ovary, and all the mature follicles or immature follicles, depending if it's IVF or IVM, they're going to take out and put into tubes outside the vagina. The thing is that this procedure is painful, and there are some clinics that provide general anesthesia, and there are some clinics that will provide more of a localized anesthesia. So I would suggest that you talk to your clinic before deciding what you're comfortable with. The procedure is pretty painful. Then there's fertilization and implantation. So this is with IVF. With IVM, there is the time that they have to take to mature the egg first. So, with the natural fertilization, they're going to take out the mature eggs and fertilize them in a little pot like this. And they're going to put many sperm to fertilize the egg themselves. Once the egg is fertilized, they will decide to keep the eggs to mature between 48 hours to a couple of days. They will then take a little tube and put it into the cervix and drop the actual fertilized embryo into the uterus and hope for implantation. Again, I want to talk a little bit about ICSI. Over here, as you notice, there is a little glass tube. They kind of hold the egg there, and they insert a microscopic needle into the egg, and they only put one sperm in this. The reason that they do this is because sometimes the outer layer, as you see, the little outer layer on the egg is too hard to be penetrated by the sperm. That happens a lot with IVM when they mature the egg outside the body, and it can happen too as you age. So this can greatly increase chances should you have any of these problems, but it will not increase chances if the egg is easily penetrable by the sperm itself. There is also something called assisted hatching. If after the egg is fertilized, the outside is too thick, they will take an egg before putting it into your body, and they will cut a little area in which the hatching could be allowed and will be taken out of the outer layer and put into your body for fertilization. This actually highly increases chances of implantation. There are risks, as there are risks with a normal pregnancy, but there are a little bit higher risks when it comes to using IVF and IVM or any type of assistance with your fertility. One of the main factors that can happen is multiple gestation, so twins, triplets, quadruplets, etc., which carry both maternal and fetal risks, including prematurity. There is also ovarian hyperstimulation syndrome. This is caused sometimes by the medications that they have for IVF to provoke the follicles to be mature. Many women have to be hospitalized to take the liquid out. Again, this only occurs in a small percentage of women, usually 1%. And women who have polycystic ovaries are at a higher risk. In addition, the good news is that if there is a possible pregnancy, there is no effect to it. But if they do see little glimpses that the ovarian hyperstimulation syndrome may happen as you're taking the medication, they most likely will cancel this cycle and wait for another one. There's also some bleeding that may occur. There's also a possibility of infection because they are putting foreign objects into your body throughout the actual procedures. And there's also a possibility of ovarian torsion where your ovary gets mixed up with your fallopian tube. Again, that's very, 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 very rare. So there's a couple things that you should think of before your treatments. I really suggest that you avoid recreational drugs, alcohol, cigarettes, and other type of drugs, etc. Also, notify your doctor if you're taking any therapeutic drugs like antibiotics, natural products like herbal medicines, etc. Also, what's really good is to have light and moderate exercise before, during, and after the procedures. You can continue your sexual relations as usual, except for the fact that you have to abstain from sex for 2 days after the HCG shot. That is to make sure that there is enough healthy sperm when doing the fertilization. Before deciding what type of procedure is right for you, the doctors will do basic investigations like blood tests, ultrasounds, semen analysis to really see where the issues are and what is the best treatment to go for you. Because there's always a chance that you can do IUI. IUI is in which they just turkey base the sperm. They put the sperm into your uterus and during the time of your ovulation. Last but not least, don't forget your prenatal vitamins, at least for 3 months before attempting to get pregnant. And don't forget folic acid. This it actually can prevent or lowers the chances of neural tube defects. So I want to thank you so much for joining me on this journey, and I hope you enjoyed my orientation. I want to wish you good luck on your journey to create your family, and I hope everything goes smoothly for all of you guys. In addition to that, I would like to thank the MUHC for all that they have taught me, and I would also like to thank all the internet sources where I was able to find the pictures over the internet. Thank you, and have a great evening.